Good morning, and it's a new time. Yesterday was budget, so we'll be back to Thursday next week at the 1 o'clock. So I appreciate people that are here today and talking to people of Rhode Island as well. So again, I echo this over and over again, but it's well deserved. Dr. Alexander Scott and Commerce Secretary Pryor, thank you so much for your leadership. And joining me today is Tom McCarthy, who's Executive Director of the state's COVID response. We'll make a few comments, but more of an introductory to the people of the state to know that we're really working very hard to make sure that vaccines get in people's arms. So for me, this is day 10 of being in the governor's office, and we've been busy encouraging efforts to get shots in the arm. So on Tuesday, we announced an ambitious plan to meet President Biden's goal of getting first doses to COVID-19 vaccine to all teachers, school staff, daycare workers by the end of the month. And I think you'll hear today that we're on track. I know that I'll be at several sites today where hundreds of school teachers and personnel will be getting vaccinated. So getting this population is really an important thing. It's the right thing for us to support our students, our families, schools, and the economy. Beginning this week, some of our state's 30 cities and towns are going to be running vaccination clinics, getting the vaccinations to our teachers and school-related staff. I want to thank the municipal leaders once again for stepping up in a way that is going to really help us. I'll be in Smithfield, Cranston, and Bristol visiting a few of these clinics later today and be overlooking to see how the process happened. I just got a nice text from Mayor Bordelli Hunt, and she's going to be active from 9 o'clock to 5 o'clock today in Woonsocket, working with North Smithfield and Woonsocket in a partnership between 9 o'clock and 5 o'clock this afternoon. So it's just a reminder to all our teachers and daycare workers to make sure that they're connecting in with their local districts to make sure that they will be hearing about the appointments directly from their local districts and respond when they do. And the emergency management directors will reach out to all the school leaders and Department of Human Services licenses for child care centers to share information and let people know how the process is going to work. But it's active and it's running now. So I know there's been a lot of news this week. This is an important point that I want to make to all Rhode Islanders. Yesterday we announced Rhode Islanders ages 60 to 64 and 16 to 64 with underlying conditions can now make appointments to get their COVID-19 vaccine. Help spread the word and encourage everybody to follow up on getting appointments. That's going to be very important as our vaccine supply increases. So our goal continues to be to get as many people vaccinated as quickly as possible. And we ask all Rhode Islanders to understand that these shots are important to keep us safe, keep us out of the hospital, and sadly, make sure that we don't have any sad occurrences with death rates that we certainly don't want. Last night we heard from President Biden once again in terms of creating a goal of making every adult eligible to receive COVID-19 vaccine by May 1st. This is exactly why our team has been focusing over the last month or more to build our capacity. We know that vaccine is coming, and we need to be prepared to make sure that we have the capacity both on a municipal level and state level and with our pharmacies to make sure that whatever we receive, we are going to get into arms as quickly as possible. Yesterday, I had actually the privilege of talking directly to Dr. Fauci to talk about Rhode Island's COVID-19 response, a one-on-one conversation. And I was glad to share the news about all the work that is being done here in Rhode Island, and in particular the new news relative to teachers. He was very pleased that we were following the President's directive, and we also agreed that we would follow up with our full team to talk to him about vaccine hesitancy, which is a very important topic that we're going to hear more about today. So today we're also additional relief to the local restaurants, in our effort to kind of do this incremental advancement of reducing the restrictions based on, again, I'm going to mention again that this is all based on a really high level of discipline, that we are following the protocols that are currently in place. This is what's going to allow us to open up the economy, in addition to making sure that we're really rolling out the vaccine. But we really need to have strong adherence to the protocols in order for this to continue at the pace that we're rolling it out. So restaurants can reduce table spacing from 8 feet to 6 feet, and bar patrons who are also eating food can stay at the bar until midnight. And our goal is to continue to identify areas where we can provide businesses with flexibility that will not impact our positivity rates or our hospitalization rates. And we will keep moving towards that goal safely. If our vaccination rates keep up and our positivity rates is stable, we expect to have announcements on broader reopening of our economy next week, which I labeled as daylight savings time, which is Sunday. So next week we'll be working steadily on that to continue to provide the flexibility that our local businesses need to survive this pandemic. This requires Rhode Islanders to do that part again. And I repeat again, please, be very diligent. Be very disciplined on the protocols that are in place. And as we get closer to the spring, we also want to make sure that our local garden shops are on a level playing field, and with any of the big box stores. If you recall, last Easter, they were at a distinct disadvantage. This year we want to make sure that all our farmers and garden shops are on a level playing field. And we continually encourage, let's support our local small businesses. This is the time to do it. They need our help, and our local communities benefit when we support the local businesses right now. So in a minute, I will have Secretary Pryor will go into more detail on the restrictions surrounding small garden shops and broader reopening to come. I'll wrap up again. I know it's repetitive, but I think it's worth repeating. Let's get the vaccines out of inventory into arms, increasing capacity so when vaccine supplies do arrive, we are ready to go, supporting our communities as we merge municipal vaccine sites into strategical regional sites, opening additional state sites, and engaging our cities and towns to vaccinate teachers, school staff, and daycare workers. Again, it only works if we work together. And now I'd like to have Dr. Alexander Scott come in and give us a good overview of what's happened in the last week. Thank you, Doctor.
Good morning, everyone. Thank you for being here with us. Thank you, Governor. Thank you, Secretary Pryor. Always a pleasure. And welcome to Tom McCarthy, our Executive Director of the RIDO COVID response team. He's joined the team and fit in wonderfully, helping to make sure that we can continue the efforts pushing forward operationally and working strong together. As I've done for the last few weeks, I'm able to stand here today and say that our data picture for Rhode Island continues to be a good one. Our statewide positivity rate continues to hover around 2%, as it has for the last month. That's huge and a great credit to all of you, because we're all contributing to this together. 2 weeks ago, we did see a small bump in our case count, but we have seen that number starting to fall again. It has kind of held steady, as opposed to continuing to increase. There are some communities, however, that we are watching the data carefully in because of the question of whether or not there are some increases. That includes South Kingston, North Kingston, Smithfield, Woonsocket, and Portsmouth. But overall, our municipal case rates are still trending in a good direction. For me, one of the best pieces of news is the situation in our nursing homes. Over the last 2 weeks, we have identified 9 new resident cases in nursing homes. And it's important to say because that is exceedingly low. To give you some context, there was a 2-week span in November when we identified more than 475 new cases among nursing home residents. And over these last 2 weeks, it's been 9. Hospitalizations and fatalities among older adults have fallen off significantly as well. As good as these data improvements are, I really want to reiterate what the governor has said and what we all have to stay focused on: how important it is for us to continue the basics that we know. We're not out of the woods yet. We're going in the right direction, but it is critical that we continue mask wearing, that we continue social distancing, we continue washing our hands regularly, that we continue getting tested regularly, getting treated for COVID-19 if you test positive and qualify, and very importantly, that we continue staying home when you feel sick. Everyone across the board in Rhode Island is very hopeful about how amazing our summer can look. We are positioned to get there. We need to continue to take the steps together so that we can reach it effectively. We really need to remain focused, especially now, especially as we start to make some of the restriction changes that the governor referenced and that our Secretary Pryor is going to go into more detail shortly on. So please keep wearing your mask, particularly in all of our public settings. It's still the rule here in Rhode Island, and the reason is because we are seeing time and time again how effective masks are at infection prevention, at keeping COVID contained. We want to stay at that 2% mark even as restrictions are opening. That's an ideal goal. We have a team at the Rhode Island Department of Health monitoring the COVID-19 coronavirus variant situation, including people from our state health laboratories at RIDO, our modeling and data and analytics team, our testing and our case investigation contact tracing units, among other areas. Our high density communities team, all are engaged in making sure we have our hands wrapped around the best attack strategies we can put in place for combating the variant as it's continuing to spread. What we are seeing locally and nationally is that even with these more contagious variants, masks work. That's a number one takeaway. Masks prevent the spread of respiratory droplets, which means that they prevent the spread of disease, particularly when it's a disease that's significantly more contagious, or a virus that's significantly more contagious than the version of the virus that we have been dealing with through most of the pandemic. So in particular, please make sure that you're wearing a high quality mask, and make sure that you're wearing your mask correctly. Your mask should fit snugly but comfortably over your nose, mouth, and chin without any gaps. KN95 masks are great, but another very good option is also a cloth mask made of a tightly woven, breathable fabric that's at least 2 layers thick. For more information, go to covid.ri.gov and click on COVID-19 prevention to see what you can continue to do for yourselves and to protect your household. To transition for a moment to our vaccination campaign, as the governor said, we are making very strong progress. We have now administered roughly 350,000 doses of COVID-19 vaccine, and 10% of Rhode Islanders are fully vaccinated. We're administering roughly 7,500 doses a day, and we are in the top 10 nationally for first doses administered per 100,000 residents. Hopefully that gives you the confidence. We knew what we set out to do with phase 1. We achieved the nation-leading drop in hospitalization the fastest and the most significantly. And then as planned, we shifted to our approach with phase 2, and we are now ranked in the top 10 for doses administered. Cities and towns are hitting the ground running on the governor's plan to get all teachers, school staff, and child care workers vaccinated with at least 1 dose by the end of the month. And as the governor shared, we opened eligibility today to Rhode Islanders who are 60 to 64 years of age and Rhode Islanders with specific underlying health conditions. These health conditions include diabetes, type 1 or type 2, lung disease such as COPD, emphysema and cystic fibrosis, heart disease, and kidney disease. People aged 16 to 64 are also eligible if they have a weakened immune system. That includes people who have cancer, people who get chemotherapy or radiation, people who have HIV or AIDS, people who have sickle cell disease, people who take medicine that weakens the immune system, and people who are pregnant. While we are very excited about taking this next step, it is important to know that not everyone is going to get an appointment on day 1. Our vaccine supply is still limited, though we are encouraged that that will start to change over the next several weeks, given Biden's announcement. There are more than 70,000 Rhode Islanders between 60 to 64 years of age and another 85,000 people with underlying conditions as rough estimates. We are asking people to please be patient early on. We will get there with time, but we are definitely starting slowly, solely because of the small vaccine supply. In addition to opening eligibility for these 2 groups, we have also been doing a lot of work and planning and implementation around getting vaccine to people who cannot get to a clinic. I have spoken at previous press conferences about how we've been gathering information for people in this situation so that we know who you are and can reach you if you are one of the individuals who are homebound and cannot get out to a clinic. Some agencies in Rhode Island have started to do some limited vaccinating of Rhode Islanders who cannot get out to a clinic, and we are currently finalizing contracts so that we can partner with 3 different vendors to perform in-home vaccinations. We are hopeful that they'll be able to start reaching out and scheduling appointments with people next week. Access is a priority for us. Equity is a priority for us. We are going to make sure that everyone who wants to get vaccinated eventually will be able to get vaccinated. And we recognize fully that we have a lot of work to do, particularly in our communities that are hardest hit with higher hospitalization rates and disproportionately lower vaccination rates. We fully intend and have a plan in place to ramp up and make sure that we close that gap. There is work to do. While we don't yet have all the vaccine we want, it is important to know there are 3 elements that are going to bring us home with this. It's vaccines, it's testing, and it's treatment. We do have plenty of treatment. As a reminder, we have a safe, effective treatment for people who have COVID-19. If you test positive for COVID-19, and especially if you are 65 years of age and older or have an underlying health condition of any age, talk to your doctor, talk to a doctor. If you don't have your own doctor, treatment is still available for you. If you don't have insurance, treatment is available for you. No matter what, we want to make sure that everyone who can accesses treatment because it works in terms of keeping people out of the hospital and keeping people alive, similar to the way vaccines do. To learn more, visit covid.ri.gov/treatment. I've talked about vaccinations, I've talked about treatment. That last key component of our response right now is testing. Treatment is critical, and so is testing, so that we can identify who needs access to that treatment. As we make the incremental changes that the governor has described, testing is more important than ever. As we are loosening restrictions, it's even more important to get involved in getting tested regularly. We have the capacity in Rhode Island for everyone to get tested weekly. Please take advantage of that. Even if vaccinated, even if people around you are vaccinated, we want to continue through this final stretch until all Rhode Islanders are vaccinated. That testing is available, and we want you to get tested regularly, weekly, as often as you can. It's fast, it's free, and it's easy. Go to portal.ri.gov to make a same-day appointment. Before wrapping up, I want to provide the same reminder that I did last week about the serology testing that we are doing. Serology testing looks for proteins in the blood called antibodies. Antibodies are produced by the body in response to the presence of a virus such as coronavirus. Serology testing gives us information about whether someone was previously exposed to coronavirus that causes COVID-19. We sent out letters to 10,000 randomly selected households about getting tested. Testing is still available through March 19th. To get antibody tested, it's still available. We've extended the deadline a week so that everyone who we have reached out to can respond and take advantage of this opportunity. If you get a letter, we're asking you to please consider taking part in this study. This kind of information is so important for the planning we're doing around COVID-19 here in Rhode Island. And with that, I'm going to pass it on to my dear colleague, Secretary Pryor.
Thank you, Dr. Alexander Scott. We are so grateful for your continuing leadership and for your partnership. Governor McKee, thanks for the opportunity to help open up business even more. We are very pleased today to be able to offer some immediate relief to small businesses, and in a week's time, we will be able to offer some very significant reopenings. We will offer some very significant flexibility on restrictions for business. I'm going to get into that now. Please display the slide. We're going to show you some of the changes that we're making. The first thing that I'm going to do is I'm going to underscore and explain in a bit more detail the changes that are taking effect today as outlined by Governor McKee. So in the restaurant category, we know that restaurants have been still suffering under the restrictions that exist. We've been offering incremental relief, but today we take the significant step of allowing for reduced table spacing. We've been holding to 8 feet spacing between tables to date. It'll be a 6-foot rule going forward. In addition, as to bars, we know that numerous restaurants really need to offer seating for dinners at bars because their customers prefer to sit there or they need the extra space. We're sympathetic to that. We know the 11 p.m. closure is a hardship to certain establishments, especially smaller ones. So we are offering relief as follows. If a customer orders dinner before 11, they may stay through midnight so long as that customer is ordering and consuming food. So there is an additional hour available for operations of bars and bar areas under those conditions. Also, as the governor mentioned, we want to make sure our smaller garden shops are able to reopen for the season and to thrive. So especially with Easter on the way and with such purchases underway, Beginning today, there'll be no capacity limits on outdoor garden shops. However, of course, other safety protocols remain in place. And I'm going to talk a little bit more about the indoor restrictions category by category as we go here. So here is the rest of the set of reopenings that we wish to talk about today. Let me offer a couple more introductory points as I do so. We are pleased to be moving forward aggressively with reopening. We are also doing so in a way that is responsible. That is to say, we are urging Rhode Islanders to adhere to the remaining protocols and restrictions. Most importantly, mask wearing and distancing. We also ask Rhode Islanders to continue to sign up for vaccinations when they're available, to get tested regularly, the points that Dr. Alexander Scott just made. Adherence to these rules and recommendations is what's going to enable us to stick with the plan I'm about to discuss and to seek even further reopenings. Okay, so beginning a week from today, that's March 19th, we are going to offer the following new flexibility to businesses. Restaurants will be able to increase their capacity to 75% with that new 6-foot table spacing and the additional hour at the bars. Those conditions can take place, those changes can take place starting today. 75% in a week. Catered events, beginning March 19th, catered events will be able to have up to 75% capacity, capped at 100 people indoors and 200 people outdoors. We had originally predicted a little bit more of a compressed number. We're going to 200 people outdoors. The catered event administration, the catered event business may allow for dancing under certain circumstances, and the rules will be articulated for those purposes, dancing in the pods of individuals who are attending the event. Houses of worship beginning March 19th will be able to increase their capacity to 75%. Let me note there that there are numerous houses of worship, churches, synagogues, and mosques that have expressed that they prefer the method of remote broadcast of the worship service or prefer to keep their numbers smaller. That is preferred. So if your congregation favors an approach that involves that kind of remote approach to the broadcast, we certainly encourage it. Electronic means are still better. Retail stores, beginning March 19th, retail stores can, in their smaller format, go to one person per 50 square feet. Currently, they're at 1 per 100. And big box stores can go to 1 per 100 from 150. So we're allowing for increased density of customers at retail stores. For smaller stores throughout our state, the permission now is to go to 1 per 50 on March 19th. Gyms, sports, and recreation, beginning March 19th, gyms and fitness studios can go to 1 person per 50 square feet. Our current rule is 1 per 100, so in a week's time, greater density. Again, all the other rules, as Governor McKee and as Dr. Alexander Scott have expressed, all the other rules have to be adhered to. Spacing, mask wearing, and the cleaning of fitness equipment. All of those things remain in place at gyms and fitness studios. Please work with us and continue to adhere to those rules. Personal services, including professional haircutters, beginning March 19th, those establishments may go to 1 person per 50 square feet. Please remember to keep 6 feet distancing and adhere to all the other safety protocols. Importantly, funeral homes, beginning March 19th, funeral homes can go to 50% of capacity, 50% of capacity from their existing numerical caps. Venues of assembly, so performing arts centers, movie theaters, and the like. Performing arts centers beginning in a week, March 19th, can be at 50% capacity up to 250 people indoors and 50% capacity capped at 500 people outdoors. Now, both for catered events and for venues of assembly, we are requiring testing at certain thresholds for the numbers of attendees involved. The required testing within a 48-hour window for the participants in an event, for the customers, that will be articulated in our guidance so that we can be clear about how those protocols work. Offices. For office-based businesses, currently at 33% capacity, we are enabling in 1 week on March 19th offices to go up to 50% capacity. Once again, we want to keep all the other protocols in place that are keeping people safe. Please close break rooms. Please avoid mingling. Please keep masks on whenever possible, etc. The social gathering limit in Rhode Island. Beginning March 19th, the social gathering limit will change from up to 2 households indoors and 3 households outdoors to up to 15 people indoors and 50 people outdoors. That's the change to the social gathering limit. So you can see that we are moving systematically and with as much speed as we think is responsible to higher levels of capacity in business and other institutional settings. We're very pleased under Governor McKee to be able to do so. The highest level we're currently permitting is 75% of capacity indoors. That's a substantial step forward for many establishments. We know that numerous businesses wish to get to 100%. And we know that some states are moving in the direction of 100%. We want to express now that we too are moving in that direction. We are moving in this step-by-step manner as we are monitoring our public health conditions, which at the moment are strong and stable, and as we monitor the participation of the Rhode Island public in vaccinations, because we want to make sure that especially our most vulnerable residents and really everyone get vaccinated as soon as is feasible. So as we monitor those conditions, we will move still further with our reopenings and aim to get to 100% of capacity in the foreseeable future. Date to be determined based upon our continued monitoring of these conditions. We want to make sure that we move vigorously and responsibly in conducting this reopening. So, Rhode Islanders, if you're asking, what can you do in order to enable Governor McKee to reopen still further, to offer still additional flexibility for business operations, please continue to wear your masks, continue to maintain 6-foot distancing, and continue to seek vaccination and testing. We're very pleased to be able to offer this flexibility today. And Governor, I believe we're going to now open it up for questioning. Thank you, sir. Oh, are we going to Tom now? Sorry.
Tom, you want to stay there? You want to say anything, or are you all set?
I think did they cover it, Governor?
Good, excellent. Beautiful. We'll open up the question.
Governor, with the vaccine supply still a bit limited, but more opening up, why not just wait a little bit longer to do some of these reopenings and I guess not push the limits?
Well,
we're so close to the end.
I don't think we're pushing the limits. I've talked about incremental flexibility. I think that we would be pushing the limits that we went from 0 to 60 in 1 second. We're not doing that, and we're doing exactly what I had asked to be done, which is this incremental flexibility, and I think that we're going to get there. And then also we got to measure. We got to keep on measuring what response we get from the people of the state of Rhode Island in terms of the safety protocols that we're asking them to follow. And as long as we're continuing moving in the direction that Dr. Alexander Scott outlined today, you can expect that we're going to do more flexibility.
Doctor, a couple of questions. One on serology. You mentioned that you've mailed 10,000 letters. You've extended the deadline. Is there an opportunity for people to volunteer for this? And then secondly, a situation in Warwick where Homebound obviously are waiting to be vaccinated. I know you've outlined a plan to do this, but why can't EMTs that are prepared and know how to administer the vaccine Why can't they just go out and do this?
So both great questions. With the serology testing for this approach, we have it designed specifically as a randomly assigned approach. So instead of people who weren't already reached volunteering, we really want to encourage the people who were outreached to, which are geographically and randomly selected to be able to participate. We hope in the future that there may be additional opportunities, but for right now, it's focusing on the ones that we reached out to.
Responses have you gotten?
We're still assessing that. So we'll hopefully in the future, once we're able to say overall, be able to tell you what our response rate is. But in the meanwhile, want to strongly encourage everyone to participate if we reach out to them. In terms of the homebound approach, we have made and worked with our emergency medical technician colleagues some accommodations that allow for being able to assist with this process. But the vendors that I referenced this bringing on just puts in place a comprehensive program so that we are organized in how we are reaching out to the individuals we have connected with. We certainly will welcome a partnership with EMT to support us in that process, but really just want to have a comprehensive and organized program that we are overseeing to make sure that those that need the vaccine get it effectively.
Governor McKee, last week Rhode Islanders celebrated the one-year anniversary of the 15-day executive order to flatten the curve. Governor McKee, when will your administration publish public health benchmarks that, when met, will result in the suspension of the state emergency order, restore civil liberties, and eliminate the arbitrary shutdowns that have destroyed the private economy?
As soon as we get people vaccinated, that's the key. We need people vaccinated, and once we hit a certain level where we know that we're safe, we will do that. But until then, we're still in a mode where we're in a safety mode at the moment, and we're doing everything we can to open up our schools and our economy in a strategic and safe way.
But follow-up, as you know, as a veteran of the small business economy, you know that benchmarks are critical because that establishes guidelines. Right now, we live on a week-to-week basis, which is encouraging this week, hopefully great next week, but shouldn't there be a set of benchmarks that, when met, will reopen the economy, as opposed to this constant moving target that we're almost there, we're kind of there?
Yeah, I think it's a good point, and we've already started discussing to get off of the hospitalization and mortality rates and getting into percentage of vaccinations in the state. So I think that's going to be new metrics that'll be there. As I just mentioned, the vaccinations are front and center. I think that the Dr. Alexander Scott, the health department, has controlled in a very serious way the hospitalizations, and now hopefully we're going to be moving that direction where we're going to be measuring it by percentage of vaccines.
One quick follow-up. The hallmark of the previous administration was to sit on the federal money, and you were openly critical of that in a professional way. But when will we see, as the money now is being determined to the state level, when will the state publish how much money and at what timeline is going to be available to small businesses who were largely, I think, avoided in the last set of federal benchmarks?
Yeah, very quickly, I think that we've announced in the budget that we're going to access $30 million from last year's CARES Act dollars. I'm glad you asked the question, because I would say we're going to be having a very aggressive effort to get PPP loans out to people. That's been extended. That's an important thing. It's been extended from the end of the month to the end of March. And then we're going to continue to work on restriction strategies that could potentially be lifted. And that's going to be an ongoing situation. I don't know, Stephen.
May, sir.
May.
Yes. Yeah.
Please. Yeah, I'm sorry, May. The PPP has been extended from the end of March to end of May. That happened, I think, in the last 24 hours. Those PPP loans, millions and millions of dollars. So every business out there, please give us a call, give Commerce a call, and get some money into the pockets of our local economy.
Governor, last night the president said that he would like to see eligibility extended to all adults by May 1st. That's not our current timeline. Are we going to do that?
So that's the goal, right? And the goal is, our capacity, as Tom McCarthy has told me, coming in here is 100,000 shots. We're capable of doing 100,000 shots a week right now, and we've wrenched it up. So the absolute goal is to open it up and to, as I asked Dr. Fauci yesterday, we'll be prepared for the supply. Get us the supply, and we're doing the work on a local level and a state level to make that happen.
What's our latest guidance on supply? How many doses are we getting next week, and how many do we expect in the weeks ahead?
Yeah, I'll defer that to the Dr. Scott, Alexander Scott, or Tom on that one.
We're currently at about 48,000 doses a week. There are marginal increases in that on the week or two that follows, but that's as far out as we go. We are very much looking forward to, especially with the announcement yesterday, additional updates significantly increasing the supply that we will be receiving.
Just one more on vaccination. We still do have a significant number of cases in the 70-plus range and the 60 to 70 range, and they're not in nursing homes now. So, Doctor, does the contact tracing tell us where those cases are coming from, or is that vaccine hesitancy or folks that we aren't able to get vaccinated, or what explains those cases?
Well, while we are over 70% for vaccinating those 65 plus and 75 plus, there are still individuals that do need to be vaccinated from those communities. And it certainly could be a combination of access as well as willingness, all of which we are positioned to overcome and address so that we have all of the individuals who qualify and who are at highest risk fully immunized and vaccinated.
Stephen and Bill. Thank you, Governor. Can you expand a bit about how your conversation with Dr. Fauci came about? What specifically did you talk about?
Yeah, so that came through our office and I believe the National Governors Association, and the conversation. It was great talking to Dr. Fauci. For me, it's like an older brother. It's like a grandfather for others. But he was very wanted to hear what was happening in Rhode Island. He was aware. He was very pleased to hear that where our infection rate was in that 2% area over the last several weeks. He was also very encouraging about our ability to vaccinate when I laid out our capacity. He was also encouraging, which was good for me to hear, a strong municipal outreach in terms of many factors, including the hesitancy. And he felt as though that was a really strong policy. And when I told him that we were doing that, as a former mayor, he was pleased about that. And he also felt as though that our density may have initially worked against us in some of the numbers, but our density right now is going to really work in our favor to get vaccinations out and to reopen our economy. So it was a very positive conversation, and we're going to get back to him and make sure he's in the loop of what's, knowing what's happening here in Rhode Island. He's a national figure that could be very helpful to us.
Thank you. Bill?
There are some events that are scheduled or potentially scheduled for this fall, and there's one event person that reached out, an event planner, that says that he's reached out to DVR, Commerce, the Department of Health, and hasn't been able to come up with, even get an answer back as to whether or not he can proceed with this event, and he's now turning to his municipality, in this case Charlestown, for guidance on whether or not an outdoor festival in September can take place. Where should event planners of any scope go to? Who's the czar, so to speak, on this matter, so people can plan looking forward?
I'll pass that to Stefan, but follow up on Dr. Fauci. As I was talking about, he felt as though that we were in very good shape this summer on those events, but I'll defer to Stefan to talk about that.
Thank you, Governor. Any large-scale event that is seeking initial guidance and initial input, feel free to reach out to the Department of Business Regulation. They will work in tandem with RIDO, with Dr. Alexander Scott's team, to start to understand the parameters of the event, whether spacing is inherently possible at the event, whether there can be demarcation markings on the ground, whether there are safe ways to conduct the entrances and the exits, where there can be pinch points, so they can have that conversation. You've heard us open up for venues of assembly today to certain levels, for example, 500 people outdoors. That may not be sufficient for some larger scale events that would ordinarily happen in the summer. We will welcome the input that I described, and in a future iteration of this guidance, if public health trends remain favorable, we will start to offer guidance for even larger scale events.
This person is saying they're not getting any calls back, though. Is there a hotline or any place that they can go for a guaranteed response?
No,
Get us the
please.
contact information,
Yes.
Bill, and we'll just go directly there, all right?
The convention center staying closed is really impacting the businesses of downtown Providence. Is there any discussion on how we're going to help tourism in the city, especially this summer? And what does a preliminary recovery plan look like right now?
Yeah, I'll just quickly answer that. I mean, and then to go to Stefan as well. Many conversations. We've had conversations with the Providence Foundation this week about that, the Rhode Island Foundation about that. We know that the Providence has been more impacted than say some of our tourist areas, which are down 20-25%, but Providence is down as much as 70%. So I'll let Stefan kind of give the details. I'm very aware of it, and we intend to act on it, in particular any area like Providence that's down so far because convention centers are closed and other activities are closed here in Providence.
Very much so. I'll note that one of the reasons that the governor and we are so enthusiastic about helping restaurants get reopened in fuller form is that we know that ours is a major food scene on the global map, so we want to enable our restaurants to become vibrant places again. We're very grateful to the Rhode Island Hospitality Association, the Ocean State Coalition, and the Small Business Coalition for their advocacy and their partnership on these points. So we're starting with some of the categories that will be tourism assets. In addition, Matt Schief and our team at Commerce are already in discussions with all of the regional tourism bureaus about their plans. And we are heavily in discussion about how to use federal dollars to leverage some pre-existing dollars and really accelerate a marketing campaign about the way in which we'll have both an exciting scene and a safe scene here, hopefully as soon as this summer. So stay tuned for more, but we are actively working on a tourism strategy.
I would also add the office space in all our communities, including Providence. We're starting to talk to people who manage and own those office buildings because we have to get them back. And Stefan announced a 50% occupancy in our office buildings. That's really critical for the downtown area in terms of, going to lunch, having a haircut, going around the corner to get certain things done. So we realize that, and we need to make sure that happens. The other thing I would just say on the flexibility, incremental flexibility, is that we also got to build consumer confidence here, right? So I think that as you move it along, and then Dr. Alexander Scott can keep on reporting that we're following these guidelines and following these protocols, we're going to build more and more consumer confidence, and that's as important, quite frankly, as opening up, right? To get that consumer confidence. So, yeah, we're focused on that. When we get the vaccines, we'll go into office buildings. When we get the vaccines, we will be ready to get people back into the areas that they need to be in. But right now, we're focused on these municipal, regional health department sites and the state sites as well.
To that question as well, is there any flexibility to reopen the convention center? I know that it's still warm from the hospital, but it will take the team a couple months to disassemble that and actually turn it back into the space that it's intended for.
Yeah, we're expecting that's going to happen sometime, but again, we're going to make sure that it's the safety issues first, and it's another opportunity for me to repeat about the variants that are out there to be very, very disciplined on that issue And the more we are, the more we'll open up, and we're looking forward to the time frame when we don't need that field hospital.
And Amanda.
Governor, good morning. Back to small businesses. When there was a rollout of money last year through Rhode Island Restore, there were a lot of criticisms about how difficult it was to apply. Sole proprietors were out, that the state was making decisions about whether a company was going to survive or not. Now, I've heard from some small businesses who haven't, but they still have debts. And I had one guy who contacted me who said, look, I've tried to negotiate with the bank. They're not negotiating with me. All these other businesses got money. What are you doing for me? So is there money of all these billions that are now coming to the state? You've got a guy, it may not be small money in terms of hundreds of thousands of dollars, but it's big money to him because he can't get on with his life. He needs to settle debts, move on, and he's looking to the state because the state shut him down. What's available to him?
Well, what's available immediately is the PPP loans if they qualify, right? That's really important. This is tens of millions of dollars. We'll definitely have a smaller type of a grant that'll help thousands of businesses within the next, what do you figure, Stephen, 30 days or less?
Yes. That's for payroll. This is for a business. He's shut. He's got debts he needs to pay off. Payroll, he has to show that he's putting that back into the business. The business is done.
Again, have them call me. You got my number. Have them call me. You got to zero down into the particulars before you could answer that question.
He's not the only one. There are other businesses out there. And so under federal guidelines, I mean, is it as simple as saying you can't give money to a business that's dead, or is there something that's available?
Are you talking about the new stimulus dollars?
I'm talking about any dollars.
Well, right now, we're still trying to get the criteria, of what you could use it for. But if we can be aggressively helping the businesses, we're going to do it.
Last question from Amanda in the back.
I have two questions for the doctor. You said that we're getting about 48,000 doses a week. Is there a number that we would have to hit weekly to guarantee that we hit that May 1st date?
Is there a number that we have to hit weekly to guarantee?
Increased dose, we're getting 48,000. Does that guarantee us to hit that target goal of May 1st? Or are you hoping to get more doses, and what number is that to guarantee us to hit that goal?
Oh, well, as described, we have the capacity to go up to 100,000 a week. We currently have the supply for 48,000, and we can even go beyond that capacity. So as soon as we are told that there is the additional vaccine supply that would be needed in order for everyone to be vaccinated by May 1st, we are ready to get started. Do you want to add anything?
Yeah, thanks, Doctor. So, with that, the bottom line here in Rhode Island is we want to make sure that we are prepared to be successful, affecting what we can control, which is building that capacity to administer as many doses come into the state. And as we look at, the guidance that the president put out yesterday, opening it up to all Americans by May 1st, we're looking to make sure that we are set up for success in that regard. Streamlining the scheduling process, other ways that we can, better meet Rhode Islanders where they are so that we can quickly get shots into arms.
Are there underlying medical conditions? It says that as we get more doses, more conditions will be added. When will that happen, and what medical conditions can people expect to see on the list?
The Centers for Disease Control and Prevention has a list that has additional conditions on it. We also know that our very important behavioral health conditions were actually not included on the CDC list. So as additional vaccine supply is available, we will want to expand to those conditions as quickly as we can. And we'll continue to inform people. We started with this particular list based on our own Rhode Island data. The diseases that are, or the conditions that are included are ones that by and large had a multiple-fold increase in being correlated with being hospitalized here in Rhode Island. So we wanted to really target those and then be able to expand to the other list, the other conditions on the CDC list, as well as other very top priority conditions that we know, such as our behavioral health conditions. And we'll be moving to that as soon as we can, and hopefully with the announcement, it'll be even sooner.
Last question.
Thank you. Governor McKee, as we've heard time and time again, the spread of COVID is not in K-12 schools. yet you decided not to include the university professors and college professors in this latest push. We're hearing from a lot who are upset about this. The spread is at universities and colleges from what we're seeing. How do you square the two, and what do you say to those professors who are upset that they can't get the vaccine like the teachers and school staff in K through 12?
So the goal is clearly to have all our K through 12 open fully in September, and the universities. So I've had conversations with the presidents this week, and I have asked them for the same count that we've asked our local school districts to give us. How many doses do they need in terms of getting the the professors and the staff there, because that definitely will get on the list, because that's our objective. So we've already started those conversations. And also, interestingly enough, there seems to be some support for making sure that just like on the chicken pox or something like that, that students that come in, there's consideration right now to actually have them vaccinated as well before they start school.
Do you have a time frame when you think that university and college professors will be added, the next eligibility group? Just when can they expect to actually be able to get their shot?
Well, we got to take a look at the information and see how many, what the numbers are in all our universities, right, state and public, or private. So we'll be able to report back once they give us that information. I requested that this week.